Hi, I am Dr. Abhinandan, consultant endoscopic and complex spine surgeon. Today, let's talk about how is life after endoscopic spine surgery. In this video, let us walk through a typical journey of a patient who underwent an endoscopic discectomy or a decompression. So, on the day 1, that is on the day of the surgery, the patient undergoes endoscopic discectomy based on his complaints, based on his anesthesia workup, either under regional anesthesia or general anesthesia. So, if a patient is undergoing endoscopic discectomy or a decompression procedure, on the day 1, he can easily walk through from the table to his ward. Usually we perform endoscopic spine surgery under regional anesthesia or general anesthesia. Let's take if the patient is getting operated under regional anesthesia, patient is fully aware of the procedure. But then when he wakes up from the procedure, he might feel a small pinch in the back, a small little soreness because of the small sub-centimeter incision. Otherwise, the patient is very much comfortable. Compared to traditional open surgeries, endoscopic spine surgery offers very little bone loss, muscle loss or blood loss. So, the patient, if comfortable, can even walk from the operating table to his ward. You will find a small band-aid, like we have a small band-aid for the normal cuts we have in our day-to-day life. That's the size of the incision which we give for endoscopic spine surgery. So, do we need to stay in hospital for endoscopic spine surgery? It is not always necessary. However, most of the people are today insured for their health. So, for the purpose of insurance, we might ask the patient to stay back for 24 hours. Otherwise, if the patient is comfortable and walking, we might discharge them on the same day or the same evening if they are willing to. Comparatively, if we do an open procedure, probably the patient might require to stay back 2 to 3 days depending on the size of the procedure, the number of levels. Also, if there is a complication, probably the patient may have to wait for another 3 to 4 days. However, in endoscopic spine surgery, even with a little or minor complication like dural tears, the patient can walk home the very same day. So, how's the life after endoscopic spine surgery? Yes, you are walking on the very same day, but you should be cautious because any discectomy procedure carries a recurrence rate of 1 to 2%. Even if it is the best of the surgeon who is operating, or even if it is the best of the patient who is taking all the precautions, there is a chance of 1 to 2% recurrence rate. In the first week per se, the patient needs to be very vigilant about his activities, especially regarding bending, lifting weights, twisting his body, or walking rigorously, or walking up and down the stairs. From the second week, we generally ask the patients to start with core strengthening exercises and also to increase the walking capacity. Let's say if the patient is able to walk 10 to 15 minutes comfortably in the first week, we ask the patient to walk up to 30 minutes in the second week. Usually we do suture removal. Most of the times it is a sutureless surgery, but however, in obese patients or patients with comorbidities, we tend to put one suture for the endoscopic spine procedure. Once the suture removal is done after 10 days, that is about 2 weeks from the day of the procedure, we usually ask the people to join their normal activities. Be cautious regarding bending, lifting weights and lifting heavy objects in your day-to-day work. You can join the work immediately 2 weeks post-procedure after endoscopic discectomy or decompression. However, we tend to caution people to avoid traveling by two-wheelers, especially in the ditches and on the speed breakers, because such activities can increase the disc pressures and increase the rate of recurrence. That is, the patient might come back with a similar problem in couple of weeks. Typically, starting from the second week, you are able to do your normal work. You can get back to your routine. If you are working population, you can get back to your normal routine work, your office job. But yes, you have to avoid sitting for long hours. Especially the operated patient should avoid sitting more than 30 to 40 minutes at straight. After 30 to 40 minutes, you need to stand, walk for a couple of minutes, ease your spine, come back, sit for another 30 to 40 minutes and carry your work. So, this regular intervals after every 30 to 40 minutes protects your back and reduce the recurrence chances. Starting from second week onwards, we increase the capacity of the patient, especially regarding their core strengthening exercises. We tend to gradually increase the number of times or the repetitions or the variations in the exercises so as to increase their core strength. So this carries up to 6 to 8 weeks from the day of the procedure. So essentially in couple of months time, you will be near normal. That is, you will be feeling like even if you had an endoscopic spine surgery or not. So you are so much normal that you are able to carry out even your sports activities after 2 months. The success of the surgery is both dependent on the surgeon as well as the patient. Yes, even if your surgeon performs the best of the surgery, as a patient you need to take adequate restrictions in your lifestyle activities and also modify your lifestyle activities and follow the regular exercises as described by your surgeon. In summary, recovering from full endoscopic spine surgery is swift and smooth. You can get back to your daily life within no time. If you like to know more such advances in spine surgery, please subscribe to our channel.